So the Affordable Care Act was enacted in June of 2010, and as many of you know, there's many aspects of the Affordable Care Act. Medicaid is just one aspect of the Affordable Care Act. And when it was enacted, there were two Medicaid pieces that were very important. One, the law was going to reduce the disproportionate share funding for hospitals. The DISH, as it's commonly known as, the acronym is DSH. That is money that reimbursed hospitals for charity care or unreimbursed care for those who presented to a hospital without insurance, without Medicaid coverage, and the hospitals provided free care to those people. The Affordable Care Act reduced that number as well as other federal funding for uncompensated care to the tune of $7.4 billion over 10 years. That was the impact on Ohio. So $750 million a year reduction for Ohio hospitals for the DISH funding. Conversely, the other piece of the Affordable Care Act, as enacted, provided for the expansion of Medicaid. And the statistics that the OHA put together suggested that the expansion of Medicaid in Ohio would increase Medicaid coverage to 275,000 people in the state of Ohio, which would increase annual revenues by about $800 million. So you have $800 million more flowing through the system, but you also have a corresponding reduction of about $750 million a year for the unreimbursed cost. So it seems like a wash. One of the issues we're going to talk about today is maybe it's not a wash, so be careful, and we'll get to that. But Medicaid as enacted isn't, or the Affordable Care Act as enacted isn't what we have on the books now, because the United States Supreme Court, when they upheld the constitutionality of the act, they looked at the Medicaid piece and said it's unconstitutional to require states to opt in if you're going to, the act said that states must act in and opt in, and if they don't, we're going to terminate funding for Medicaid, the existing Medicaid. The United States Supreme Court found that that was unconstitutional. So the result was states had the ability to opt in. As Jim just said, Ohio was the 26th state to opt in. That was part of a large gymnastics event between the Ohio General Assembly and the governor's office. As I said the other day, you don't really want to know how sausage is made. You don't really want to know how this law became, how Medicaid was expanded in Ohio, because it was really kind of a, actually, if you're a lawyer, it's a pretty interesting thing, and we can talk about that later. But I have 2 minutes left, so I'm going to move on. That took a lot of meetings and a lot of brief writing, but Ohio expanded Medicaid. The result is we have the reduction in the DISH, we have an increase in the amount of Medicaid funding that comes through the state, but the problem is, and this is really the takeaway of what I'm here to talk about, the problem is the government reimburses hospitals about 83 cents per every dollar that's spent on Medicaid. Well, there's a difference there, and that Medicaid difference is going to get bigger as you push 275,000 more people through the system. And so that's what the fiscal people in the hospitals need to be aware of. Just because we're going to have an additional $800 million coming through the system annually doesn't mean that you're in good shape. You've got to look at the bottom line. You've got to look at the loss of the DISH funding. You've got to look at the enhanced revenues from caused by the expansion of Medicaid. But then you're going to have to look at that difference between the cost your cost of providing those services and the amount that the government reimburses you for those services.